Roll call. Joni's absent. Attest to publication. I did see it today.
I saw it on the website.
Thank you. Approval of the agenda.
I'll make a motion to approve the agenda.
Motion made by Shelley, seconded by Lori to approve the agenda. All in favor?
Aye.
Opposed? Motion carried. Thank you. We will start out with discussion and approval of the framework for the mode of learning decision. And I ask that we hold our questions till the end, just because it builds on itself. So if that's okay with everyone on the board, thank you.
Okay. Well, welcome everybody to tonight's meeting. And as Julie said, we are going to be discussing the Bangor Harvard framework. We've had a lot of discussion on opening our school and what that should look like. And so previously we talked about some different frameworks and some different measures to do that. So what we'd like to do tonight is to show you, review some things, but then also bring in some new data to show people and have a discussion regarding that framework. So Rick, if you don't. So again, the reasons for the framework, the Bangor Harvard framework. Obviously, first and foremost, it's about the safety and health of our students and staff. And that can be not emphasized enough. That needs to drive everything that we do. But we also need a framework and guidelines. As I said previously, and I use the analogy of snow days, we need to have some framework and guidelines in order to make these calls. We just can't just go from instant to instant, whatever you may call it, and make different decisions. We need a framework and a guideline. We need a medical background basis to make these calls. Again, as administrators, educators, we're educational experts. We're not medical experts. So that's why we've leaned on the La Crosse County Health Department, Dr. Sammy Brunell, our school nurse, and to make and get some ideas about that framework. The Harvard framework and Harvard model is science-based. Obviously, it is mathematically and science-based. And so that is one of the reasons that many, many districts have used the Harvard model framework. It's flexible and moderate. And so one of the things that we want to emphasize again tonight is that there are numbers to the model. There's different metrics. And it doesn't mean that a metric is, let's say, for example, that 25 out of 100 when we talk ACE rates. That doesn't automatically mean when you hit that number that school is closed. We are going to be looking at a number of factors, a number of metrics that will help us make that decision. So it is flexible. And one of the things that the La Crosse County Health Department has over and over is that it needs to be a local decision. Yes, use this information, but it needs to be flexible according to the districts that are using it. We also are going to show you tonight that municipalities' population in our district. And we're going to talk about some mathematical calculations that we've done that related back to the Harvard model. And so there will be a number of slides that you will see on that. Have Mike Johnson, our elementary principal, explain that as a MIN team, we went through a lot of hours, excuse me, of looking at these calculations. So again, later on the slides, we will talk about using municipalities' populations in order to make part of these decisions that we're going forward. We will still, though, look at the La Crosse County numbers because we don't live in a bubble. And if I know that we're in Bangor a little bit, we're different in the context of location, but the numbers are the numbers in La Crosse County. So we have to understand that they have an effect on our district, on our municipalities, on our students on our staff. And then multiple stakeholders to make decisions. Again, I want to emphasize that when we go forward and we have to look at the possibility of closing school, opening school, I am going to use multiple stakeholders to make that decision. Again, I use the analogy of the snow days. I make tons of calls when we look at that. So in this case, when we're talking about COVID-19, school openings and closures, I'm going to be talking to La Crosse County. I'm going to be talking to Worsing, our medical advisor. I'm going to be talking to Tammy Brunell, our school nurse. I'm going to be talking with our admin team. I'm talking with other superintendents to see what's going on in their districts. So it's multiple stakeholders with decisions. And I can't emphasize that enough. Rick? At last seems like a month ago, last week's meeting, we talked about neighboring school districts are doing. And again, I just wanted to put this up there because the question was, what are neighboring districts our size? And again, Sparta and West Salem are a little bit bigger. But Melrose Mindoro uses solely their health department, Jackson County Health Department, to make their decisions. Again, there's only 3 schools in that county. And so Jackson County is able to be, very honestly, more agile, responsive because they're not dealing with the population of La Crosse County. So Melrose relies on Jackson County to help them make their decision. Cashton is the Monroe County Health Department and the Harvard model. But again, they differentiate between Monroe County and we're talking about Sparta next, that Cashton may look a little bit different in terms of what their case rates are versus Sparta. So, but both of them, as you'll see, Sparta also uses the health department and the Harvard model. So there is some differentiation between those districts, even though they both use the model. West Salem, as you're aware of, also is in our county, and they use the Harvard model. And as you're aware, last couple of weeks ago, they moved the case rate number up. And again, to fit their needs, but they also rely on the model. And as you know, they went back in person last week, but then because of the case rate numbers in La Crosse County, went virtual this week. So again, I wanted to highlight the districts that are close to us, they're doing and using as measures for their opening and closing. Next one. So a reminder of the metrics that La Crosse County Collaborative uses. Again, there are 2 primary metrics and 2 secondary metrics. So the metric 1, again, is the new case rate per 100,000, and it's based on a 7-day rolling average. And so if you look today, the new case rate increased from last week. And I believe it was at 97 is what they're averaging daily in La Crosse County. So the parameters are, again, they're considered red if it's 25 or greater. It's orange if it's 10 to less than 25. Again, when we look at orange, they use the descriptor of its accelerating spread. Red is tipping point. If it's in yellow, if it's 1 to less than 10, there's community spread. And then also at the lowest end, green, which is less than 1, and it says you're on track for containment. So that's metric 1. Metric 9, which is the positive test ratio. And it's red if it's greater than 10%. And I believe the model today showed it was at 39. So obviously that is very concerning. If it's between 5 and 10, it's orange. Yellow is between 3 and 5%, and green less than 3%. Next one. So then the secondary metrics are the 7-day origin close contact. And again, they use that number when they're looking at when somebody identifies as positive, who has been in close contact, they call it contact tracing. And so what they consider red is if that's less than 60%. And then you're concerned about the community spread piece in that. So again, the higher the number in that close contact, the better it is because they can trace who came in close contact with a person that tested positive. So then orange is 60 to 80%. As I said, the higher, the better. Yellow is more than 80%, green higher than 90%. Then the last secondary metric actually works off metric 1, which is the case rate trend. And this is very, very important because one of the things that we will use going forward is how is it trending? Because if we are between yellow and orange or between orange and red, one of the things obviously that we need to look at, how is it going? Is it increasing, which would not be good, or is it decreasing, which is obviously better? And so we need to look at that trend rate as something that's very important along with those other metrics that we're looking at. Next, Rick. So the use of the Harvard metrics in La Crosse County Collaborative. So the metric 1, again, you can see if you go on their website, we would propose using the 7 municipalities in our district to look at a new case rate baseline. So we would use that, and then in addition, again, look at La Crosse County. So, and again, we will talk about what that looks like in later slides. We would continue to use metric 9, the positive test ratio, because that, from the La Crosse County Collaborative, because that gives us good information about our people being positively identified and those numbers. We would continue to use the 7-day origin, the close contact numbers from La Crosse County Collaborative, and we would continue to use the case rate trend from metric 1 out of the La Crosse County Collaborative. So we will continue to use the metrics from the county collaborative, plus looking at our case rate by municipalities. Next, Rick, please. So if the Harvard framework, if we adopt it, again, a reminder that if you are red and greater than 25 cases per 100,000 on a rolling average over 7 days, the recommendation is to be virtual. If it's orange, 10 to less than 25, then we could go in person, 4K 8. And the reason that we include middle school is we have the ability in our school to cohort our middle school. Because one of the big things, recommendation in orange, if you look at the model as it is, as it was adopted by other schools, they don't recommend middle school being in person in orange. And that's specifically because of cohorting. And so we are able to do that with a lot of hard work by Mr. Mullenberg and his staff. We are able to cohort. So in orange, it would be in-person 4K8 and hybrid 912. If we are in yellow, 1 to less than 10, it would be in-person 4K8, and then hybrid or in-person 912. And again, that would depend on where we are in yellow. Are we trending up? Are we trending down? So that whole thing about in-person or hybrid 912, that's a discussion based on what the metrics are showing us. And then last, of course, where we all want to be, green, less than 1, we would be in person. Next one. So the next slides are the data that we gathered regarding our municipalities. And I'm going to ask Mike Johnson, who science math background, to explain these next slides. And again, if Josh, Mr. Chaplin, or Mr. Mullenberg, if you want to add anything as we go through that. So, Mike?
So over the past week, had the opportunity to speak with Jackie Cutt from the health department. She's the young lady that does all the data for the map that everybody's looking at and hovering over the numbers that pop up. So it was really with her collaboration to kind of work through these numbers. And actually, you know, both sides of the fence were helping each other out in terms of making sense of the numbers, and then the graph and then the daily case rate numbers. These are the populations of the different municipalities that we serve. And the reason we picked the municipalities is we serve families there. We certainly don't serve all families. The data is not available by district boundaries. So we're not able to take the students or families out of Hamilton that we do serve, and the families are not, and delineate through there in the data realm. As you can see, the number up there is 10,411. That excludes Leon and Sparta townships, as they are both in Monroe County, and data does not line up with the La Crosse County system. And I think we were talking a total of, is it Rick, 8 students in those 2 townships. So we went with the 6 that were readily available in the data set. And if you notice, the village and town of Bangor is combined. The reason for that is when they ask, people are not delineating when asked positive or negative tests, are not delineating between village or town of Bangor. They're putting just Bangor, and that number is coming in to 1 set, according to Jackie. Turn the page. Basically what we did is took the 25 in the Harvard model to make it equivalent to what our population was. Math problem really is just solving for X. We ended up with 2.6 new cases per municipalities would be equal to what the 25 grade data is for the entire county. The trick is taking a 2.6 times a 7-day average. And so if you take our entire population of all of our municipalities of 10,411 people, and the case rates were distributed equally, 18.2 cases in a week in our municipalities would be equal to an average daily case rate of 25 in La Crosse County. Next, so 25 rolling average. So you take, this is where it kind of makes sense to the map itself. When you hover over the map, you get things like Rockland has 1 candidate or 1 positive case, and it's 23.3 or 6 or something to that effect. I know a comment last week was we're going to let one case in Rockland shut the whole school district down. Well, that's not equivalent math. You have to look at the case rate over 7 days. Rolling average ends up being 175. So you can see that 1 case in Rockland at 23 is nowhere near 175. So we wouldn't close down in that case, or that wouldn't be an equal number. I will say though that when you get to various, again, I'll go back to 18.2 is a case number for 10,000 people. When you get into Bangor, the municipality of Bangor, that population and how it compares to the population of Rockland or even Farmington, those are different entities because of the disbursement of people and how you look at and this is through talking with Jackie and her calculations of figuring this out. There's much more to it than just a 1 number equals this. It's case rate, it's population densities, and other factors that come into generating that number. So even though if we took the 10,411 people, distributed cases over all of them, we would be concerned, or when we hit 18.2, that would be the equivalent of 25 on the Harvard model. But the 175, if you hover over all 6 of those municipalities and that number, you added all those up, Rockland's got 23.6, Bangor's got 9.8. You add all of those up, when you get to 175, this is not straight math, but you could argue that there's 18 positive cases rolling day average in the municipalities that we service. So again, 1 case in Rockland doesn't do anything to the total, but 8 or 9 cases in Rockland would be very concerning. And based on the size of Rockland and the likelihood of spread and the population density, that would be very concerning to in connection with the numbers. Then the next slide is just simply the orange and yellow and green. It's basically orange is 3/5 of whatever 18. So you just run from 7.2 to 18.2 cases. We would be in orange over a 7-day average. Yellow is 2/5 of 18.2. So you'd end up with between 1 and 7.2 cases over 7-day. And then green again is less than 1. So similar to, it's the same ratio as the Harvard model 25 and so on. Interesting, the next slide. So when we talk about 18 being a number, the number of cases in our municipalities over since July in 1 week's time has not been more than 3. But based on our population in our district of 700 staff and students, mathematically, you would anticipate that after 14 cases in our municipalities, it would find its way into the school or would have already been there. And I think that's the part that really hits home is we're talking about a number 25, but we probably won't even get there before our schools, in all honesty. You can see this is this week's numbers. You're looking at the comparative. So we have 6 townships, municipalities. This current number probably going to change tomorrow, but as of right this week, it was 9.8. We're at 9.8 over 7 days. We're looking for 100, or the Harvard model is looking for 175 over 7 days. And because of the size of the different townships, there are different ways that they calculate threat of spread based on densities and area models. And that's according to Jackie Cutt with the Cross Health Department, who makes she actually went through her spreadsheet and actually turned numbers for us to see what it worked out as, and pretty impressive Excel spreadsheet, I would say. The last slide is simply a question that I think was raised last week about what does 40 look like? What does 35 look like? And such. And you can see the math right up there. It's, a 25 case rate is 2.6 per day, and it just incrementally increases. And then what that means over the course of 7 days and such. But again, mathematically, based on our population and the population of our municipalities, we figure somewhere in that 14 range. If it's not in the schools, it would be. So the point is getting to the conversation about changing from 25 to 30 or 35, that kind of thing, might be a moot point.
Okay. Just piggyback a couple things off what Mike said. Again, when we look at our municipalities, and I know that on that case data map, when you hover over it, then you see, all the way from La Crosse out to Bangor. And in the past, we had talked about, okay, one case in Rockland was at 23 something, and then one case in Bangor, 9.8 approximately. Again, those numbers, if they are not going to shut down our school. As Mike said, though, if we have 8 or 9 in Rockland, or we have 8 or 9 in Bangor, the village, township, then those numbers start to become concerning just because of spread. And I don't think it's going to be very long before it makes our way into school. Also on the way between, as Mike said, that 18 number, we're going to start to see in the school when we get, let's say 10, 11, 12, you use it, 14, we're going to start to see instances in our school where with kids that are positive, or then we might have to quarantine kids, we might have to quarantine classes. And so before we get to that red number of 18 municipality-wise, 25 on the rolling average for the Harvard model, there's going to be things happening in the school before that. And so when you talk about, positive cases, you talk about quarantining and those things happening, then it's also becomes a thing of when those factors come in, okay, then the staffing piece will be affected. And so how many staff can we have out of the building in the elementary, middle school, high school before we are not able to function as a school? So those are all things that before we hit this number, I think you will see in happening. And right now, Rick and Mike have been in contact with their colleagues and seniors, and they're 2-3 weeks into school, and that's what they're seeing. I mean, they haven't shut down yet, but there has been numerous quarantines, numbers of positive COVID cases, and I know that they're as principals, that's the main concern, is being able to run the school and to have the staff available to do that. So I just want to make sure that we don't get fixated on that's the only number that's going to determine how things go. It's not. There's just many, many factors that will go in. And one of the things after we're done with this agenda item, Tammy Burnell, our school nurse, is going to share with you thresholds, triggers that La Crosse County is giving us. And again, they're not going to say you do this at this point. They're giving us some guideline numbers, much like this, that, okay, when you have this percentage of students absent out of your class, then consider this. And whether it's a class closure, whether it's a building closure, or whether it's a district closure. So again, it's recommendations. And so numerous things will be taken into account on that. So Mike, Josh, or Rick, anything you would like to add at all? I'm going to ask Dr. Worsing if there are some things that she wanted to comment on the PowerPoint or some things that we missed, and same thing with Tammy. So Dr. Worsing.
I think I just want to clarify a few things. I think the math is there. You could see it. There was a lot of work put into that. So thank the administrative team for that. So the 4K through 8, they talk about the importance of getting them back first. Here you can socially distance. In other words, do the cohorts. You can physically distance, so be 6 feet apart, and they'll all be encouraged to wear masks. So it's safer to get them back face-to-face more consistently because you're able to do those things within those groups. For the high school, 9 to 12, you can encourage masking. If they're hybrid, and correct me if I'm wrong, but if they're hybrid, you can physically distance, you can do the 6 feet apart, but you can't necessarily cohort. So that's why the distinction is made between those. I think everyone wants a black and white, but you can't. The data is gray. We have to use the data that we're given from La Crosse County. As was mentioned, it doesn't drill down to school district. It goes by municipalities. But then within all of these frameworks, there's decisions and ways to tailor that so that things can remain safe.
Dave, if I can just comment real quick, at the elementary level, I just sent an email out last week to parents, and in that email, I made we're good with social distancing in most areas. We're not perfect. And we're able to cohort, that's for sure. And that's a big one, but there are classrooms that students are 5 feet apart as opposed to 6 feet apart. So that's our best effort at social distancing in some areas of our school. So I just wanted to clarify that.
So this week we received some.
So I don't know if you had any comments on this at all. Sorry, Tammy didn't have any comments on this. I will ask Rick, back to Dr. Worsing's comment about the hybrid, because as she's consistently pointed out, the 3 factors that will mitigate the spread of COVID are cohorting, masks, and physical distancing. So I do want Rick to talk a little bit about the hybrid, because as much as we'd like to say we can get it to this level of social distancing, very difficult based on class sizes. So I'm going to let him explain further on that.
Thanks. So at the 612 level, we have 50 sections that are over 18 kids, and 18 is kind of the magic number of size as far as 36 square feet per classroom. So at the middle school, worked with Ms. Schultz to cohort everybody so they can stay 6th grade class together for all day except for band, 7th grade, 8th grade, the 3 sections that we have. High school, they take electives, so they're mixed classes within 9th, 10th, 11th, and 12th grade. So we have a number of those. I mean, they're in that 50 as well as a number of sections over 18. So because of that, and Dr. Worsing's advice on that is, in order to have that distancing to go with the hybrid model, she'd have half here part of the week, and then the other half, the other part, and the rest would be virtual. So they would still have that instruction would still be each day, but it would just be half at home and half here. And the way we would do that, we look at doing that as alphabetical by last name. So it's pretty even split on that. But our middle school, we can't distance them per se, but we can cohort and mask them. And Dr. Worsing said that that's 2 out of 3 if we can meet that. So that's why we can do that at the middle level.
Thanks, Rick. A couple other things I wanted to add is, again, using this framework, if this is what we adopt, those decisions on closing, again, if this model gets to those numbers, it would be made on a week-to-week basis. So what I would be doing on Wednesday is obviously looking at all the data and talking with all of the people that I mentioned before. So if we would go to orange to red, and again, we're seeing other factors built into it, then it would be a week by week. So I would make a decision on Wednesday, and people that have days. So if we switch learning, obviously, if we switch from in-person to virtual, so by that next Monday, we would start the new mode of learning if it necessitated that. So that would be on a week-to-week basis. If we have outbreaks in classrooms or building, again, to get the proper number of days in terms of quarantining, all of those things, that would be a 2-week thing, because of the fact you're supposed to have 14 days in terms of the quarantine, 10 school days. So a class closure may look different. It will look different or a building closure may look different than going on this model in terms of week to week. So I want to be clear on that. And again, that 14 days is based on the medical recommendation in terms of quarantining. So Julie, I guess.
Questions?
Yes.
Questions from the board for Dave, Mike, Rick, Dr. Worsing?
Are we looking to act on this prior to the threshold discussion? Tammy's point?
Yes, we are. They're separate agenda items.
Yeah, Paul, because like the threshold and the exclusion deals more with that, class with the building, but the exclusion obviously talks about individual cases and decisions that be made, by our school nurse, by medical people. So it's a separate item.
Dave, how will parents be notified of whatever we do, either classroom-wise, district-wise? How will they be notified? You talked about when, but I guess how?
Well, they'll be, obviously we use our JMC system, which has modes of communication, Lori. It has, direct phone calls. It has direct emails, texts, and so, and obviously the information on the website also.
Okay, so we would post on website
Yeah,
too?
yes.
Okay.
Anybody else? Thoughts, questions?
I don't have a question, just like to comment that there's been a lot of input from a lot of people, especially in the last 24 to 48 hours, and that's always appreciated. And I would like to recognize everyone who's put work into what we see in front of us tonight. There was discussion last week about adjusting the number of 25 to 35 to 40 or whatever. And I personally, seeing what I'm seeing now with the math that we've been presented with tonight, I can't support that, but that's just me. So I would ask if anyone else on the board has a question or a comment at this point, or I will proceed with a motion.
Exactly is your motion? Like, what are we approving? I'm really curious about the metrics because you describe it. I'm saying, what are the metrics that we're approving? Are we approving the greater than 25, looking at our municipalities, which puts our number at, depending on, the number, 9.8 of cases over the, but that's not even close to the Harvard model. And that's what I'm asking. So which numbers are you proposing?
What I would suggest that we approve the metrics as presented tonight based upon the flexibility built in, meaning we'll use the municipalities as one of the inputs. So rather than changing the 25 to 35 strict with the Harvard, we would use what was the figure? 18.2 based on the municipality population as one of the inputs, and as well as the other inputs that they outlined. To Dr. Worsing's point, everyone wants a black and white answer here, but there's not. The other thing I would say is everyone wants to have input, and they should, and we have received a lot of input, but ultimately, when there's not a black and white switch to flip, somebody has to make a call. Hence the need for a framework, hence the need for this motion tonight. We have a superintendent we hired to make these decisions, and that's the way I believe we have to proceed.
Just a clarification, the 18.2 is over 10,000 people. It's not, that's assuming that the virus is equally distributed over 10,000 people, which I think we all agree it probably would be in a hotspot like Rockland or Bangor or something to that effect. So you would look at the 175 as opposed to the 18.2.
So if I'm understanding it right, then we're not there. We are not at the place. We're not at red because our numbers aren't that high. Am I understanding it right?
That's
Like,
what I
Because
understand.
you're looking
That's what I
at this.
understand.
Mhm.
Wait, I need clarification on that. Explain that. So right now, today, with La Crosse County being in red, we would be open?
We'd be at 9.8 based on last week's data. I anticipate that's going to change tomorrow. Based on last week's map, and it's updated once a week, there's a 9.8 case rate for our municipalities.
And do we need to be at 175 to be
Yep.
in red?
So that would
So-
be, let's say, 8 cases in Rockland will put us at 175.
So today we're at 9.8. We need to get to 175
Yep.
to be in red.
That's the equivalent to 25. That puts us at red.
I don't think I'm still following you. When we're going to be going off of La Crosse County numbers, or we're going to be going off of both, kind of? is what you're
Across
saying?
county numbers for our municipalities will be an indicator along with the trending rates within La Crosse County itself, unless I'm saying that wrong, Dave, but I think that's.
No,
accurate.
we would, to what Paul's point is, we will use the metrics that we have. We will use the metrics, still use the metrics from La Crosse, the case rate and positive ratio, and then the secondary. We will add then our case rate for our municipalities. So if our case rate for our municipalities is yellow or orange, then we will go in person. Okay. But we have to also look at what's happening around us in terms of La Crosse County.
But if I were a parent looking at these stats, I would not know that until we come out with that decision. Is that correct? I could not just look off La Crosse County numbers.
Correct. Yes. Yep.
And if I heard right, since July, we've not had more than 3, right?
Right.
In our municipalities.
But when I looked at La Crosse County's website, so it'll show you that graph, right? And so from when this started in spring, we were in yellow, we stayed in orange. We would have been in school all the way up until the 9th of September when we hit red.
Mhm.
Went off La Crosse County numbers.
Right. Well, if we had drilled down to the municipal numbers, again, remember when we made the decision to go with La Crosse County, that was the data that we had at that point. We had not drilled down into what we're talking to tonight. So, and we as a county group, we use that data to make the decision to go virtual.
I think what my point mainly is for the general public to understand, if we go with La Crosse County numbers and we don't go with our municipalities, it would be out there for everyone to see. You wouldn't have to dive down to those areas and we still would have been good. So once the spread is under control, we would be right back to orange and yellow like it had been for those months.
I think yes, but I think you're assuming the spread's under control in La Crosse County. And I'm looking at the school district, we're at 9.8 now, and we were at 3 since July. I mean, I think everybody knows the last week has not been good in La Crosse County, and I have absolutely no idea if that includes Bangor or Rockland. So I don't know what it's going to do but this is much better to me looking at, okay, we've had 10, let's just say 9.8 over the last 7 days versus, the county rate of whatever it is. I have it somewhere. Right. As
Yes.
Tracy said,
Yeah.
it's per 100,000 people.
Right.
Right, exactly.
But again, we would look at these metrics in totality. It just wouldn't be that we were looking at, metric 1 or whatever. we would be looking at it in totality. So we're looking at, because we'll have the case numbers for our municipalities, for our district. So we will be able to say, okay, are we in yellow? Are we in orange? And then again, looking at the other metrics from the county, we would make a decision based on that. But
If lacrosse was in red, then that would trump that? I mean,
no,
no.
no, not necessarily, because again, if we're still, our numbers are still in that yellow and orange, then that would be the primary factor, is the municipalities.
I agree with Paul. I'm very grateful that we had the information and the data and everything put up in front of us. What scares me is I wanted to see the numbers of our municipality, and when I seen them, you would have to have quite a few cases. And if our surrounding areas, like we didn't talk about, Sparta, or like they surround us also. So if they're in red and lacrosse is in red, more than likely we are probably in red too. I'm open to letting this be open and flexible. I'm just saying we're probably not red if they're red, and I mean, we're right in the middle. And I like the fact that we would have been open up until the 9th. So I am fine with what was shown and leave it up to our experts to make the decision.
Okay, any other comments?
Yeah, I guess I'd like to know what you keep saying, the other measures, the other measures. Walk me through what that means. So let's just say in our school district, we're at a 5, but what other measures you're gonna say, well, we're set a 5, but we're gonna close down?
So you said at 5,
I
what
just
number?
made up a number, that our school district number is really low per 100,000, but you
Right.
want us to close. Tell me what those other you keep saying the other metrics, which ones, like, and what numbers are you using? Like, I have it in front of me, but I want to know what you're.
Well, the first metric would be what our numbers are showing in our municipalities. So if we had, as Mike said, the mathematical formula that we have 9.8 in Bangor, we have 23.3 in Rockland, we have some other number. So if that isn't adding up to 175, then we're in that orange, or depending on what those numbers are, we're either in orange or yellow. So if that's the case, then we are in person. But again, we're all still going to Tina's point, we're going to look at the metric from La Crosse County. Where are they trending? Is it getting worse and worse? So we'll take that into account. We'll look at the metrics for positive test ratios. Those are important. So again, those two metrics, metric 1 and metric 9, and then the two secondary metrics plus our metric for looking at our 7 municipalities.
But you're going to follow this, what's written here.
Yes.
Yep. Sorry, you don't have your microphone. So last week we kind of talked about our district and where we're moving and how people travel and move and spread, right? And so there's warnings not even to come into La Crosse County from certain places or to leave Wisconsin. So is it better to go off of just your health county department? Or is it better to be lenient like this, like you said earlier, and have that middle ground to be able to make those kind of logical decisions off of like Sparta or off of those surrounding areas?
So a few things, the Sparta information and the Monroe County information, if you've looked at their website, it's not as specific as La Crosse County. So it's very hard to say how many cases there were in Sparta versus all of Monroe County. And then you look at the La Crosse County, they do give us much more information, some of it almost too detailed or too complicated to follow easily. But when you look at those maps, what's been happening these couple of weeks are the cases that they have are very densely focused in La Crosse. Not even on Alaska or Holman. I mean, they've gone even up to Orange, I believe, at some point. But when you look at the total number of cases, it's really been centered in sort of a hot spot in La Crosse. So you have to take that into consideration because yes, we have families that work in La Crosse. We have kids that are going back and forth because they know people in other districts. So we don't live in a bubble. But when you look at the county, the Bangor School District has been very different rest of the county. So I do think it's okay to look at that separately. I think you need to take into consideration what's going on around you. And that's why when you go through that model, there is a lot of gray. So if you're very solid in the middle of yellow, you're probably not going to look at some of those other indices that closely. If you're edging up to the border of yellow to orange, and then there's some decisions to be made about more people going hybrid or some even virtual or, you know, changing how the school is functioning, then you start looking at those other data points as well. Okay. Does that answer your question? So the other thing, so all of this conversation has been very focused on the COVID numbers. It's very important right now. We are in a pandemic, and I don't want to minimize the importance of decreasing the spread and making sure fewer people get this virus. But there's more to the wellness of a student and the wellness of a community than just this COVID pandemic. And I think all of the parents feel that very much, you know, last week with the conversations about how their kids are actually doing with all of this. So I think we need to look at this very reasonably. We need to be open to what's actually going on around us, not just within our county or within our state. Because even though we don't live in a bubble, Bangor is different than downtown La Crosse. Does that answer your question?
It does. It kind of goes back to what Shelley and I were discussing, people going back and forth. And what I didn't ask last week was like staff. We have a lot of staff that don't just live within the district, or my other concern was busing. And so we can say we can cohort smaller, and maybe we can if every single parent brings their kid in. And so that's not going to happen either. So these really are things that we haven't brought up, and just these numbers that I think we have to take into consideration. And like you had said too, right? One case in one house is more than just that one case probably. So I just want people to know different things and different views, and the other things we're thinking about, like not just the 12 kids in that elementary school. There's other things that are going to it. So we might be able to put masks on them and space them, but that doesn't mean that everybody's safe at that time either. So just discussion.
You're right. When you bring people back, there will be some risk. And I think that's been seen in every school district around us, that as they've opened, there's been some cases within the school. This Harvard framework, this matrix that we're looking at is really about what happens when everything else is going very well for the school, that they have enough staff, that they have the ability, as it was listed in one of the metrics that I saw, that they're able to provide safe and quality instruction. Okay. So if the community numbers start getting worse, if some of those metrics start getting worse, even if things are going very well for the school, we should consider not being open. But once you have it within the school, you're looking at in each individual class, and that's what Tammy's going to go to next. So it really is two separate issues. It's not a matter of if somebody in the school gets it, honestly, it's a matter of when, and then how we're going to manage that.
And I do think busing is definitely like, how are you going to cohort buses? Like, that's a tricky one. I don't really, do you have a plan for that? Cohorting buses?
What was your question, Jack?
Are you gonna, how are you gonna how are you going to cohort buses? So when they get here, they go just to their homeroom in elementary school or just their middle school, but they're gonna then get on the bus and go home with mixed cohorts, and then they're gonna come back
The-
and mix cohorts, like.
They will be mixed when they're on the bus. There's no way around. We are going to have seating charts. They will be required to wear masks, and we will sit them together by siblings. So we do have a plan, but you're right. It is not on a bus. You can't cohort. And just like we're talking at the high school level, we can't cohort. And so we have a plan that we think is based on talking to other districts, what they're doing on their bus. So yeah, we have that plan in place.
And my other comment is, for the last 6 months, we've been going places and doing things. Not everybody, but if we haven't brought it back to Bangor in mass yet, I don't know why we think it's going to be different in the next 3 weeks, because we haven't yet. I mean, it's obviously it's increasing everywhere. We've heard that, right? I mean, we know the metrics are going up, but we're doing, I mean, those of us who work in lacrosse have been going to work in lacrosse and coming back to Bangor. Those of us who go shopping and come back. Like, not, if anything, with the spike, I think those of us who do those things are going to go back to being a little more careful, but I don't think it's going to be worse. So keep saying, oh, well, but people work in lacrosse. Yeah, we do. But we've worked in lacrosse for the last 6 months and haven't brought it back to Bangor. So I don't think that that's going to happen any differently in the next 3 weeks or whatever, 6 months, however long we're making these decisions for, which will be different every month.
Okay, any other questions? Good discussion.
I move that we adopt the Harvard model as it was presented tonight based on the metrics, including the primary metric of the 175 based on the municipality populations and the other inputs as described in the presentation.
Motion made by Paul, seconded by Shelley to adopt the Bangor Harvard framework as presented tonight. All in favor? Opposed? Motion carried. Thank you.
Thank you. Next up, discussion approval of exclusion and threshold plans. So I'm going to get that set up for Tammy, and then she is going to walk you through that. So.
Earlier this week, we received some guidance for school closures. And La Crosse has their only proposed recommendations for closing a class or a school. Most others that we are going to deal with will be on a case-by-case basis. And a lot of it will be based on the contact tracing that we get done quickly to identify the cases in any one room at the school or an entire school. So basically on Wednesdays, based on our enrollment of our students, um, in the past, I have reported to La Crosse County influenza-like illness, and that's what the ILI stands for. They've added the CLI, which is COVID-like. So it's nothing new that I'm reporting. What they want to look at is anything between 10 and 20% of classes being absent would be something where we would discuss what's going on in the classroom. Anything between 5 and 10% of absences would be talked about. And when we would really get concerned about closing a classroom or a school, we would be at that 30% per day for 3 consecutive days for a classroom and 20% per day for 3 consecutive days for a school trigger. The percentages are for guidance only, and it doesn't necessarily mean that action would be taken immediately. It would just be something that we know we would need to talk about. We'll be monitoring this through our absence lists, and Joyce and Melanie will help me with that. Does anyone have any questions about that? So when it talks about the 10% on any reporting day, that would be a trigger for La Crosse County to contact me, and we would talk about what's happening in the school. A non-reporting day, I don't report on any other days except for Wednesdays. So I did ask for clarification on what's the difference between 10 to 20% being out, and they said basically there's no difference. We would just look at what's going on in the school. Do you have any questions about that?
Any questions for Tammy regarding page 5, the school closures? You have another sheet, Tammy, and this is the
Yes, this
colored?
is the colored sheet, and it's, Dave, are we gonna get that up on the, okay. So this is the chart that we'll be using for when we're seeing students or staff with illness in our schools. If you have cough, shortness of breath, difficulty breathing, new loss of taste or smell, that would be only one symptom that would exclude you from work or school. 2 symptoms, which would include fever, chills, muscle aches, headache, sore throat, fatigue, congestion, runny nose, nausea or vomiting, or diarrhea. Symptoms that are outside of the student's baseline, 2 of those symptoms would be basis for exclusion. The recommendations are to send the student and all household members home. Basically, they want us to find out if the staff or student is a close contact to a confirmed case of COVID. If they are not, we recommend testing. If they are not tested, they are considered a suspect case and would be excluded for the 10 days. Since the symptoms were onset and 24 hours fever-free, household members, the best practice from a public health perspective would be to exclude the household members for 14 days. And that's because it can take 14 days for symptoms to show up after you've been exposed.
So Tammy, on those, when you're doing that, are those considered part of your threshold? Your flu-like symptoms, when you're doing that, when you're excluding them, so you're getting to your,
Right, we would add them to our absence list. And I mean, some of them could be added at the beginning of the day, some, you know, it would depend on when it would happen during the day, but for sure it would get added to our list.
and they count as a CLI then, correct?
Yes, unless, yes. If the student, say they are sent home with a fever and a sore throat, and we do get a diagnosis of like strep throat, for instance, we would follow the healthcare providers' recommendations and use the Wisconsin Childhood Communicable Disease Wall Chart, which we've already been using. And then all well individuals from the household may return to school. In the event of testing, if we did have a positive case, I would work with the health department and help with contact tracing. The student or staff would be excluded for 10 days since the symptoms started. And they would also have to have symptom improvement and be fever-free for 24 hours before returning. Household members, again, would be excluded for 14 days if they're not able to isolate away from the positive case in the household. And then in case there's a negative result, as long as there are symptom-free without medication use, they may return after 24 hours. And all well individuals or household members could return to school or work.
And so, I'm sorry, Tammy, are you still,
Sure. No, you have any questions?
Lori?
So Tammy, let's say this happens, I'm just going to say 11 o'clock lunch and kid comes in and says they're not feeling good. What do you do then to isolate them from the rest of the population?
So we would appreciate a phone call so that when they come to the office, we can make sure they have a surgical mask on and we have isolation rooms at both schools. So I would assess them and they would go to the isolation room and we would call the parent and have them pick the child up. And if they had other siblings at the school, we would have them pick them up too.
Okay. And then from a temperature perspective, we each get checked, obviously, when we come in. When will the kids get checked based on what school they arrive at? So for example, will elementary be different than high school?
All of the first hour teachers at the middle high school have thermometers.
Okay.
So before that even, we do want parents to be screening their kids at home.
Mhm.
We don't want them, to send them if they have symptoms and have a fever. We want them to be checked at home if possible. We will check them again at school the first hour of the day. At the elementary, the teachers have thermometers as well as in the first hour classrooms, or actually all the homeroom classrooms, sorry.
Okay.
Anything else, Tammy? Are you finished?
As long as there's not any other questions. I know that it seems really strict for exclusion and I know people get worried about, the number of days that they're missing school or work, but we have to do this so that it's basically so that we don't get COVID in the school. I mean, we know it's going to get into the school at some point, but we want to minimize the spread to other students and staff.
Any questions for Tammy? And this will be sent out, if we approve these, will be sent out to all of our families with all of the other information we'll be sending.
I will be sharing this with staff. We have some in-service on Friday.
Great.
So they'll get this to review before Friday. And then I will also be sending the exclusion chart out to parents and as well as a letter to the parents by Friday.
Dr. Worsing, any comments? Mhm.
There's no other questions.
Motion made by Shelley, seconded by Lori to approve the exclusion and threshold plans as stated and presented. All in favor? Opposed? Motion carried. Thank you. Dave, October 5th return to school plan.
Right again. Okay, here we go. Okay, as has been the plan when we talked about virtual instruction through the month of September. The October 5th, which would be Monday, and if we are in the yellow and orange category, again, based on the La Crosse County map and based on our municipal numbers, the plan would be to return to in-person instruction, again, 4K through 8, and hybrid in the high school. Again, depending how, next couple weeks go. But as has been the case, while the numbers may go up some, again, we will look at the municipal numbers and the La Crosse metrics and return if those are where they're supposed to be. We will look at coming back in person and hybrid on October 5th. So Rick, would you like to talk a little bit about middle school, high school, and then I'll just ask Mike to talk a little bit about the elementary.
So based on that, our middle school would be cohorted and they would be Monday, Tuesday, Thursday, Friday. High school would be one cohort, half the students A through L Monday, Tuesday, M through Z on Thursday, Friday. Wednesdays would be used for staff to contact any students who would be in quarantine when that arises, and also those that may be struggling. We also anticipate that our staff up here will be subbing for our other staff as they're gone during their prep periods. So if there's any other time left on those days to help prepare as well.
Rick, do you want to talk a little bit about using the shared staff?
Sure. The middle and high school share staff. So we have staff that teach everything from 6th grade all the way on up through high school. So we have to stay on the same schedule because of that, as far as with our middle school and high school. So we've been going on a block schedule, 90-minute classes, 7-minute passing times in between to allow for sanitizing of the desks. There's a 5-minute dwell time in between that Mike Stang said. So a little bit longer passing time on there, but the schedules are the same. And we would be Zooming and recording the lessons for those that are quarantined that need that, and putting them on Google Classroom as well. Yes, odd even block. So you go 2 days in a row, so you have all of your odds and all of your evens. So correct.
Good, Mike?
Well, we'd be back face to face 5 days, no even or odd or anything like that. We have to adjust our schedule a little bit because of cohorting abilities or that. So our specialists will be a little bit different in terms of their locations and their schedule, but recesses were cohorted and separate for initially. Initially we're going to be fairly strict in order to see how far we can get through this. As new information comes, I hope we can move closer to a normal day at the elementary school, but unfortunately, we're not there. So we're going to do some staggered releases. I just sent out an email today anticipating larger numbers of vehicle traffic, parents not maybe sending their kids on the bus for the very reason that was brought up earlier, trying to deal with traffic there and so forth. But we'll be there 5 days a week, and it'll look a little bit differently, but we'll cohort, we'll wear masks, we'll wash hands, and we'll get it done.
So Dave, just one quick question. So you will make a decision on September 30th as to whether or not we will for sure be in the yellow or the orange
Yeah,
status?
I will communicate that, Lori.
okay.
Yep. And again, the plan is if we stay in that orange and yellow,
Mhm.
yes, but I will definitely.
But that's the day
you-
you would be looking at?
Right, right.
Okay.
Yeah, the map data comes out on the 1st, and so.
My question was, we have two things in here on that first metrics, and one of them was looking at La Crosse County Collaborative, especially for their trending. If they're trending super high, we would still go with our colors? Like, how do you determine those two things?
Yeah, I mean, if they're trending.
I mean, like right now, they're at a peak.
Yep.
So that's my biggest concern. I mean, when
Right.
I voted on this, it was between those two things. Even if we were in yellow and orange, you have that flexibility to look at that trending, because it's going to be very difficult for people to know when we're going to open depending on who makes that decision. And so I think I need to understand a little bit more how much we're going to take into consideration trending points. And then if we look at, if we're going to take into consideration that part of it, I don't think I'm there yet. I don't know.
Yeah.
We totally voted. I just want to know how we know where that's at. Like, how is a parent going to know, but just with the information that we send out? Is that it?
Well, yes, I will let
Okay.
them know where it is trending, because again, what I'll send out, Tina, will be, the example of the learning, the Bangor mode of learning and everything. But I will then continually communicate with them, this is where we're at in terms of these metrics.
Thank you. All right, 4-year-old and 5-year-old kindergarten return plan.
I'm gonna have Mike speak to that. Thanks.
I just, knowing that the 5th of October is coming up, and I will be honest, the traffic flow really is nerve wracking, and wondering how that's going to play out, because we're just uncertain. But another thing that weighs heavily is just the experience for our 4K and 5K children, our youngest learners. And that first day of walking up to the school doors can be intimidating. It can be an emotional thing. And if I feel like if we waited until the 5th, the morning of the 5th, to usher in our youngest learners, then I just think we would get a lot of tears and a lot of parents that are really frustrated and that sort of thing. So I'm proposing the opportunity for our Wednesday 4K parents to bring their children to school, drop them off with us for the day, as well as 5K parents do the same, drop them off with us. I'm not proposing busing. I'm just proposing if parents are able to get them to us, we would like to give them this opportunity. And then Thursdays, 4K families would have the opportunity again. That would give them at least a kind of a day to see the school, meet the teachers, walk in without the rush of the rest of the kids there. I just think it would be a nice opportunity for our youngsters to get off the school year in person on the right foot.
Mike, and then with 5K, that would be
3 days, Wednesday, Thursday, Friday.
Okay.
Say that again.
The 5K would stay Wednesday, Thursday, Friday. They
Okay.
have the opportunity to stay Wednesday, Thursday, Friday. We wouldn't count. There'll still be a virtual component to that if they want to stay home and watch from home, but or participate from home, I guess.
And the 4Kers would be there Wednesday or Thursday.
Yep.
Okay. do we need a motion or?
Yeah, why don't we make a motion and just, so it's reflected in the minutes?
I'll make a motion that we, okay for the 4-year-old and 5-year-old, or the 4-year-old kindergarten and the 5-year-old kindergarten to come to school as Mike described, the 4-year-olds on September 30th or October 1st, and the 5Kers on Wednesday, the 30th through Friday, the 2nd. Motion made by myself, seconded by Shelley. All in favor? Opposed? Motion carried. Thank you.
Thank you.
Dave, next item, special meeting.
Yes, at last week's meeting, I shared information with you about our revenue limit and our levy rate and our debt levy rate. And we had talked about having Brian Brewer, who is the financial advisor for the district from Baird Company, present. And so the date that worked for him was September 30th. And I know that even though the October 1st is when they certify the valuations, he said that those numbers truthfully don't vary a lot. But he said if they vary, by a certain percentage, you can make that recalculation on your budget and on your revenue limit. So he didn't feel that that would have a dramatic impact on the budget. So again, based on his availability, September 30th, and he said if it works, he can do it early. So he suggested 5:30 would be able to start at that time. And he can do it at 6 if he has to, but he said, he's got a couple other meetings and everything. So,
And he will be meeting with us virtually.
yes, I'm sorry. Thank you, Julie. Yes, it will be a Zoom meeting, and he will present the information. I'll be sending out information at the end of the week regarding documentation that he'll be sharing at the Wednesday special meeting.
So is everyone available? Okay. Time. So he gave us between 5:30, 6.
If he said if he could be available at 5, but he said the earlier the better for him because of other meetings. So if it's possible at 5, great. If not, he said 5:30 would work. 6 o'clock would work.
Joni
So-
works till 4:30, I think. Or 5. Is it 5?
So should we on safe side
5:30?
5:30?
5:30.
Okay.
Paul, Jack, Shelley, Tina, Lori. All right, 5:30.
So we'll need a motion, Julie. on
Okay,
that.
5:30 on Wednesday, September 30th. I need a motion. Motion made by Lori, seconded by Paul to hold a special meeting on Wednesday, September 30th at 5:30 PM with Brian Brewer from the Beard Company. All in favor? Opposed? Motion carried. Thank you. Alternative open enrollment apps.
We have 2 students that are requesting open enrollment to Onalaska Northern Hills Elementary. They have been attending Northern Hills Elementary. So they just recently moved to Bangor, so they want to continue to attend there. So we have a 5-year-old kindergarten student and a 3rd grade student, again, asking to go to Northern Hills in Onalaska.
Can I just ask, do you know how many that's out this year? I have 19.
Yeah, I don't have the exact number, Jack.
Do you know about how much that is per student?
about 7,200.
Okay, thanks.
So Paul made a motion. Did I hear a second? Oh, thank you. Motion by Paul, seconded by Lori to approve alternative open enrollment applications. All in favor? Opposed? Motion carried. That's all the business we have listed. I ask for adjournment. Correct.
Right, yeah. They
They're a
have
new
never-
family that's moved here.
Right.
Thank you. Adjourn. Motion made by Shelley, seconded by Lori to adjourn. All in favor? Opposed? Motion carried. Thank you.
Thank you.